This is a demonstration of the PPE donning and doffing sequence using airborne, contact, and standard precautions with eye protection for the care of patients with potential COVID-19 disease. First, you're going to gather your supplies. You'll need gown, N95 mask in the size that you're fit tested for, and your eye protection, either goggles or a face shield. You'll need gloves, and you'll need the checklist. If you have a buddy available that can help you, we'd recommend it. The PPE that you see here may or may not be the same as what you're using in your location, and also, over time, the look of the supplies may change.
PPE is donned outside the patient's room. Complete the step-by-step checklist in order when donning PPE. No personal items such as jewelry, rings, watches, cell phones, pagers, and pens should be worn. Long hair should be tied up. Eyeglasses should be secured. Inspect PPE prior to donning. Visually inspect the PPE to ensure that it is in serviceable condition without tears or rips, that all required PPE and supplies are available, and that sizes are selected correct for the HCW. Test PAPR if using. PAPR is used for aerosoling or high-risk procedures, or in cases where the clinician has failed fit testing with an N95 mask. The entirety of the rest of the process is equivalent in both situations.
You're going to want to make sure that the belt is adjusted properly to fit your waist. And you'll need to check the airflow with the flow meter, securely placed in the top of the air blower. Turn the power on and watch for the float to rise. You'll also need to ensure that your filters are attached. Before placing the PAPR on and attaching the hood.
Perform hand hygiene with alcohol-based hand sanitizer.
I'm also going to roll up my sleeves. If you're wearing long sleeves, you'll want to push them up so that your wrists are left bare.
Put on isolation gown. Tie isolation gown at waist and ensure back is fully covered.
This gown has two ties, one at the neck and one at the waist. Any of the ties should be tied in the back and not in the front of the gown. To prevent the sleeves from sliding, it's helpful if there's a thumb loop in the gowns. If your gown does not have a thumb loop and you are able to make a small hole for your thumb to go through, it will prevent the gown from sliding up your wrists. If you don't get full complete coverage in the back, you can also use a second isolation gown. That one would be put on like a jacket with the opening in the front, and then the second gown would be put on as demonstrated with the closure in the back.
Put on first set of gloves. Ensure the cuffs are pulled over the sleeves of the gown. Put on N95 and eye protection.
I've been fit tested to wear a small N95 mask. I'm going to separate the straps gently before placing the mask. There's one strap at the top and one at the back. It's snug under my chin.
If you're using the face shield instead of goggles, pull the mask part over itself and wear the mask part over your forehead with the face shield down over your eyes. Tie the face shield behind your head. If a PAPR is required, it replaces the N95 mask and eye protection. To use the PAPR, attach the PAPR hose to the machine and then to the hood. Secure the PAPR belt to your waist and turn the PAPR on. Place the hood on your head then pull down the PAPR hood under your chin. Now continue by putting on a second set of gloves. Ensure the cuffs are pulled over the sleeves of the gown. Verify. After completing the donning process, the integrity of the ensemble should be verified by the HCW to ensure that the PPE is fully intact and complete. On exiting the patient room, you'll follow the doffing sequence for the PPE you are wearing. We recommend that you continue to follow the checklist and complete the PPE checklist in order when doffing PPE. Remove outer gloves only. PPE is removed outside the patient's room. As with all PPE doffing, meticulous care should be taken to avoid self-contamination. Ensure that there is a waste container for all PPE. Perform hand hygiene over the inner gloves with alcohol-based hand sanitizer. Remove N95 and eye protection carefully and dispose of in waste container.
You want to do this step slowly and carefully, pulling the mask away from your face and up over your head.
Remove gown.
Some gowns may be difficult to break off and could tear or splatter, so you may need to untie your gown. If you have a buddy that can help you, that would be ideal. If not, make sure that your hands are clean before you reach around the back to untie.
Remove gown. Avoid contact of scrub with outer surface of gown during removal. Pull gown away from body, rolling inside out and touching only the outside of the gown if possible.
I'm removing the gown slowly and away from my body.
Pull hands out of the inner gloves, leaving them inside out and wrap inside the used gown.
And if the gloves don't come off completely with the gown, you can still remove them afterwards.
Perform hand hygiene with alcohol-based hand sanitizer. And lastly, instructions for doffing the PAPR. Carefully remove the PAPR hood. Be careful not to contaminate the inside of the hood. Unbuckle and remove the air blower. Disinfect the PAPR hood, the air blower, and the belt according to manufacturer's instructions before storing or reusing the papper. This concludes the doffing sequences.